So I'll structure this similar to last few times, where I'll talk first about where things are going with cases in Niagara and the state of the pandemic generally, and then talk a little bit about a vaccine update for us. Not going to belabor this slide, which I've talked about really the last few weeks. The predictions of all the modeling was over time, variant cases would go up, non-variant cases would go down. The variant cases would eventually overwhelm the non-variant cases, and we'd sort of see this U pattern of overall cases coming down, flattening out, and then heading back up. And as I've shown in past weeks, that's exactly what seems to be happening. This is the Ontario Science Table showing their data on what they're seeing with variants, and of course it's going up and going up relatively sharply. The non-variant cases have come down and largely have flattened out. And so, if I combine the two together, we, get something like this. This blue is still the non-variant cases showing that flattening out. And then when you add the variant cases to look at the total trend, you can see we now actually have a very sharp upwards trend in terms of cases across the province. We are well past where we were at the first wave. We're probably about, halfway from where we were back to being at this peak of that second wave. So the numbers are starting to go up very sharply here. The Public Health Agency of Canada put out their latest modeling on Friday, and they're predicting that if we stick our current course, at least the national numbers, which I think would mirror what we'd see in Ontario, shows that that sharp increase is going to continue. And it's only by reducing the number of people we have social contacts with that we have any hope of flattening this out. And of course, thus far, we're not really seeing a trend that's working in that direction. We are seeing more and more social contacts. We are seeing more infection spreading. And so I don't know how we get off this upward trajectory and flatten it out based on the current decisions that are being made in the province. Obviously, the reason we are concerned about cases is because a percentage of cases are going to have more severe illness. They will be hospitalized. They'll eventually need to go into an ICU in some cases even. And so just, drawing here what are the active cases looking like in Ontario, that, very much mirrors the trend of what I just showed you with the new cases we're seeing every day. I've modeled this on this active case axis here. I'm now going to draw in hospitalizations to show you what that trend is. Obviously, the true hospitalization number would be very flat if we are drawing just the exact number here. So I have a secondary axis where I'm going to plot that out just to make it clear. And so the proportions are going to be a bit off, but I think it helps with seeing what the patterns here. And this is what hospitalizations look like. And so, I think the first point I really want to make is that as we've seen the blue line of cases go up, we are seeing the orange line of hospitalization starting to go up as well. And that's going to continue on. And of course, if we see that blue line go extremely high, that means that hospitalization line is going to go extremely high. I think it's just notable here that you can see hospitalizations were a lot higher during that first wave than the second wave. And that's probably because we weren't testing as widely during the first wave, and this blue line actually should have been higher, but we missed a lot of cases through that first wave, which we didn't in the second wave. The other thing I just want to point out is that the orange line typically lags the blue line. So there's a delay between, of course, people becoming sick with COVID-19 and them worsening enough that they're going to be hospitalized. So that orange line tends to be a lagging marker. You can see it came down slower. It does actually seem to be tracking relatively well this time, but that makes me worry that we're perhaps seeing some early hospitalizations, and there's going to be a lag where it's going to be even higher, that we see more hospitalizations in a couple of weeks. And that's, of course, going to be very concerning. Drawing in the ICU numbers here, and that's going to be on the same axis as these hospitalizations. You can see it's, likewise mirroring that it goes up when cases go up, comes down when cases go down. Obviously, we never brought our cases all the way down, so we never brought our hospitalizations and ICU numbers down. And we can see that ICU number starting to go up, and it's nearing where we were at the peak of that second wave. And so that's, of course, going to put a lot of pressure on our hospitals. This is all provincial data. I talked last week about how Sunnybrook Hospital was starting to build a field hospital in its parking lot, and this is, the latest pictures that I've seen of that field hospital. So very much, looking like a military-style, almost MASH-like hospital that they're basically building in their parking lot, expecting that they're going to be overwhelmed with the number of cases soon. And I believe Joseph Brant Hospital in Halton, Middlesex London Hospital, or sorry, London Health Sciences Hospital in London, Ontario, both had field hospitals set up during the second wave, which I assume are still around now. Hamilton Health Sciences, I know, was starting to look into potentially building one as well in one of their parking lots as well. So the hospitals definitely see what is coming, and they're very concerned about this. Now, the variant cases we've seen so far in Ontario have largely been the B117 variant. That's the variant that's originating in the UK. And I'm just going to show you what the numbers look like, where most variants have not yet been sequenced, so we haven't been able to identify them. But of the ones that have, you can see it's overwhelmingly this B117 variant that originated in the UK. The other two major variants of concern are much lower. But one concerning detail I've noticed over the last couple of days is that 2 days ago, the P1 variant was actually at 61. So it has gone from 61 to 82 in just 2 days. That's about a 30+% increase just in a couple of days. And so that's a concerning sign and something that I'm going to be paying close attention to over the next few days. The reason why this variant is so concerning is this is the variant that's in Brazil, and perhaps you've seen some of the news stories in Brazil where their cases are rapidly rising and their hospitals are really overwhelmed right now. I think they've been reporting several thousand deaths a day now. I think their most recent number is 4,000 deaths in a single day. This variant appears to be more deadly and more severe than the variant going around that's building up in Niagara in Ontario. As well, this variant seems to be less prevented by the vaccine. It seems like this variant evades the vaccine. And so if this variant starts to rise in Ontario, that of course makes everything that we've seen become much worse. And if you've seen news out of British Columbia, they are seeing, of course, they're heading into a third wave similar to us. But it appears that they have a very large number of the P1 variant that has emerged there over the last few days. They're saying that they actually have more P1 variants in one of their labs than the entire US has diagnosed. That lab, I think, is over 200 of the P1 variants now. Couple contextual details. This lab in Ontario actually does about 70% of their variant testing. So it is a reflection probably of the province as opposed to just a small geographic area. As well, the US does not have the same extent of testing architecture that we do in Canada. And so we are probably picking up a lot more variants than the US is. So this headline is perhaps a little bit misleading about the true scale, but regardless, I think it does signal how large the number of variants of P1 have been identified in British Columbia. And as I mentioned, we're talking about 200 of those variants. If we go back to here, in Ontario, we've come up with about 1,800 total variants. So 200 that have been sequenced and identified as a P1 variant in BC is, of course, a pretty large number. And if that variant starts to take off in BC, I think it's very concerning about the potential for it to spread here, just given that there still is a lot of interprovincial travel around Canada. This is the story in BC, and just to quickly show you what the cases per 100,000 by population looks like in BC versus in Ontario. Green line here was Ontario, the red line is BC, and you can see BC has been trending up similar to Ontario because of their variants taking off similar to ours. Shifting over to the Niagara story, it's fortunately not quite as grim here in Niagara, at least not yet. With our daily variant numbers, we've actually seen a little bit of a drop over the last few days, where we are getting about 14 variants per day, and we're dropping to about 8 or 9 variants a day now only. It's possible there could be a little bit of a reporting lag, and this number is going to go up a little bit if there's some catch-up reporting of new variant cases by the province. But that is at least a little bit of encouraging news that we're not seeing quite that same sharp increase that the province of Ontario is seeing. Overall, though, our case counts aren't looking that much better than Ontario. These are our non-variant cases, and you can see that we've started to go up a little bit with our non-variant cases. And when you layer in the variant cases, of course, we do have an upwards trend, but at least we haven't got to, halfway back to the second wave peak that the way the province as a whole has got to. The reason, of course, cases are going up is, as I mentioned, the degree of social interaction that we are having in society. If we look at our latest mobility data here, looking at people who are out and about, going to shopping, going to recreation, I talked about how that trend was trending upwards last week. And if we look, we can see that, it was about here last week. It is continuing to go up, and we are actually now back to where we were through the fall. And of course, in the fall, we were in the yellow and then the orange levels, as opposed to the red level of restriction where we are. So per level of restriction, those restrictions don't seem to be keeping our level of social activity lower than where they were in the fall. And of course, if this trend line is going up, that portends that our cases are going to start to spiral more and more upwards as a result. Looking at people staying home, a very similar trend we're seeing, where the number is, normalizing to where it was in the fall, and we're probably having people staying home less than they were in the fall now. And again, that implies there's probably more social interaction going on. And we've seen where this can lead, of course, across our border in Hamilton. Hamilton has entered the gray lockdown level as of today, and that's, I think, a result of how much their cases have been going up. And I just want to quickly talk about how Hamilton's cases have been trending, and how that maybe shows some implication to us here. So this is sort of what the case trend has looked like in Hamilton since the start of February. Of course, early February, they were on a downwards trend. This was around the time that the province decided to start reopening and taking regions out of the stay-at-home order and back into the color-coded framework. And Hamilton moved directly into the red level. And you can see pretty much as soon as things opened up, they started to see their cases move up and up and up. March 6th is significant because this is when the rest of the province, namely Toronto, York, and Peel, came out of the stay-at-home order. And there seems to be a small inflection point there where cases start to go up even more quickly in Hamilton. Not sure if that's directly linked, but the timing does seem interesting that it occurred around then. In Niagara, we were starting off very similar to Hamilton. Unlike Hamilton, we didn't reopen into the red level, we reopened in the gray level. So we were able to see our cases continue to go down for a little while longer. But as we reopened, went into the red level, our cases did start to go up here. And you can see where we are is basically where Hamilton was, maybe 4 or 5 weeks ago. And my concern is that this trajectory is going to continue on over the next 4 and 5 weeks. We could well be seeing ourselves very similar to Hamilton, especially given the amount of travel that occurs between Hamilton and Niagara and the potential for their cases to start to seed and spread to being cases here. I think we see the benefit of the delayed reopening here in Ontario, where it perhaps has bought us a few extra weeks where we aren't at the same level of where Hamilton is, and why perhaps our overall numbers aren't looking quite as grim as the Ontario ones as a whole. But definitely the trend is not looking very hopeful here, and I am worried we could be seeing something more similar to Toronto a little bit later, or Hamilton a little bit later. Finally, I just want to put up this slide here that was with the Public Health Agency of Canada, because this is, I think, their key messages on their briefing on Friday, and I think they're really good messages that really, I think, match with what we're talking about. The forecast shows that variants of concern are spreading, and we're going to have cases go up. Vaccination is going to help us get cases under control, but it's probably not going to get up that quickly. We aren't going to be able to have 40, 50% of the population vaccinated in just a few weeks. It's going to take a little bit more time. And so we need to be very careful about relaxing measures. We need to be careful about having social gatherings, about interacting with others, because that's fueling the increase in cases. And particularly as we head into some important holiday seasons that have started or are going to be coming in the next few weeks, there's very much the opportunity for those cases to start to spiral even more out of control. They advise that we need to have the fewest interactions with the fewest people for the shortest amount of time at the greatest distance while wearing the best fitting masks. And I think that's absolutely what we need to be doing. Cutting down our social contacts as much as possible, sticking to just our household, keeping our distance, wearing face coverings, limiting as much social contact as we have. That's the only way we're really going to bring cases under control. And it may end up being the province puts in restrictions on us again to basically force us to get there. The earlier I think we do it ourselves, the better we'll be. And perhaps there's still the opportunity that we can avoid a government-imposed lockdown to prevent that social interaction, and we can do it through voluntary activity. But as I've shown with the mobility data, it doesn't seem like that is taking hold yet. And so I'm not very optimistic of where this leads. Switching to a little bit of more positive news, just touching up where we are with vaccination. So we are continuing to work through the vaccination priorities set by the province. We are still finishing off the last part of phase 1 of vaccination, but of course we've expanded into parts of phase 2 with last week the 75 to 79-year-olds able to register vaccination, and as of this morning the 70 to 74-year-olds as well. So we're making progress in that group. And as well, we've made some progress into some of the high-risk congregate settings, as I've talked about in the past. When we look at provincially what vaccination coverage is looking like, you can see, actually our northern territories are actually the real leaders here with vaccination, where they've done extremely well. The vaccine supply has been limited, and so that has held us back, I think, in most other provinces. But Ontario is sort of middle of the pack here, not quite as good as BC or Quebec, but doing better than the Maritimes, doing better than Manitoba, really on par with Alberta and Saskatchewan. The province has been putting out actually a new weekly report now, looking at what the vaccination coverage is like, and that 8.2% that I mentioned is showing up here. And they actually do a little bit of a regional breakdown of what it looks like by different regions. And just looking at some of our peer regions here, we can see that, there's a bit of variation across different regions. We in Niagara are about sitting at 9.3%, which is a little bit above the provincial average, but most areas seem to be in a pretty tight group around the 7 to 9% range. I do want to caution that we shouldn't necessarily read this as saying that some regions are ahead like us versus some regions are behind. I think so much of what we see with vaccinations just has to do with the allocations by the province to different regions, and then regions use up their vaccinations as quickly as they can. Depending on your age structure, that makes a big difference in how much you're able to vaccinate. So Peel region, of course, has a smaller elderly population than we do in Niagara. And so we've had more opportunity perhaps to vaccinate our elderly than a place like Peel region. So this isn't necessarily a reflection of how well people are doing. This is a reflection of what vaccine shipments look like, what is the age structure of the population that you're vaccinating, how many of those groups are now within the priority groups that are open for vaccinations and the like. But I think the important thing here is that we are seeing Niagara is up to over 9%, and that number is continuing to climb. And that's, of course, very good news. Looking specifically at the 3 priority age groups in which we are vaccinating, we are making very good progress with the 80 plus, where we're approaching about 3/4 of that age group has now been vaccinated here in Niagara. And as I've shared in past week, we have almost the entire rest of this group queued up and booked in for our clinics. We've made some good progress with the 75 to 79-year age group. A week ago, we were under 20%, and now we're close to 40%. So we're definitely getting some of those individuals in for vaccination. The 70 to 74 group, of course, opened up, and so we're starting with about 7% of them already vaccinated. And that's probably through the targeted efforts that we have been doing in long-term care homes, retirement homes, other senior-specific congregate settings. And so there's good progress being made across our 2 age groups where we started vaccination. We expect this one is starting to grow as of next week. So things are, I think, looking well so far with our vaccination rollout here in Niagara. We do have another couple weeks of clinics at least planned, and we're starting to work on filling out some later weeks as we get information from the province on where our supply is going to look like in those weeks. We're, of course, today starting a clinic in Fort Erie. I do want to highlight that it does seem like there have been certain concerns this morning and over the weekend around registration for vaccination. It does seem like some of the appointments that we have up on the provincial system aren't necessarily always showing up to clients who want to register, or at least some clients are able to see them, some not. We've heard complaints that people aren't seeing any open appointments, but then, a few hours later, we do see that our registrations have increased. So people are, at least some people are finding their way into clinics. I'd caution, we're working with the province to let them know these issues, and they're working to try and figure out what's happened. If people are having trouble getting into clinics, I just ask them to be patient, try again in a couple hours, and hopefully it's going to start working again. We are seeing our clinics start to fill up. So there's not going to be, unfortunately, all of the options available anymore to book into, because many of these locations have started to become full, but there are certainly some open spots still available. And over the next couple of days, we'll hopefully have some new clinics put out for the week of April 11th to 18th. So there'll be more options available for everybody. Niagara Health is, of course, also now on the provincial portal with their clinics, so their clinics will also appear there for others to have the opportunity to vaccinate. So unfortunately, some hiccups with registration, but overwhelmingly, I think 95% of people are managed to get registered into clinics successfully. And we are definitely seeing our clinics fill up. We're doing about 2,000 vaccinations a day here in Niagara between us and Niagara Health. So for the most part, it's all good news, but unfortunately, a few hiccups that we're dealing with. And with that, I'll turn it over to some questions.
Okay, thank you, Dr. Hergy. So our order this week, we're going to start off with Richard Harley and then Bonnie and then Stephen. So let me just go here and I will unmute Richard. Okay, you should be able to unmute now, Richard.
I don't have any questions right now. Thank you.
Okay, thank you. Over to Bonnie. Give me one sec here.
Hi guys, thank you for hosting today. Dr. Hirji, I was going to ask you a question. You just kind of touched on it about people having issues booking their appointments. What would be your best advice for that 5% of people who just can't seem to get through? Do you think they should be calling? I know they're directed to call Niagara Public Health, and then, you know, our health unit is asking them to call the Ontario booking system back. What would be your best advice to them?
Yeah, so I definitely would not recommend they call us locally. We don't run the registration system, so unfortunately, we're not really able to do anything. I'm not sure why the provincial messaging often is to call us locally, because it needs to really be handled with them since it's their system. I think an option for them is they could try calling the phone line at the province and see if they're able to register by phone. I do understand that the waits are relatively long, and I think with 12 or 13 regions opening up to 70 to 74 bookings, there's probably a lot of people calling that line. So my best advice would really just, take a break for a couple hours, come back and try to register. Hopefully the issues will be, working by then. We've seen success where some people have delayed for a couple hours, come back, and it's all been better. And as I mentioned, we're going to be adding some more clinics in the next few days, so there will be lots of opportunities. Everybody will have their chance to get vaccinated. Unfortunately, it's just going to require some people have a little bit more patience in the meantime.
And my other question,
oh,
yes,
ahead.
Thank you. My other question was, I know that the clinic on, I believe Wednesday is the first time that it will be hosted in 2 different locations. Is this a situation where you just kind of split staff down the middle and kind of just relocate staff members to each clinic? And are they operating on a smaller scale? How does it work?
Yeah, no, absolutely. We do have 2 different teams. So different teams will be going to each of these clinics. Just by the nature of the 2 locations, the one we have in Niagara on the Lake in Waynfleet, and then the next day in West Lincoln and the following day in Lincoln, those are smaller sites, so they actually don't have the same throughput that we can have at a place like, Grimsby or Welland or Niagara Falls. So, now that we've had some experience, we've gotten everybody trained up, we've gotten our systems really optimized, we're able to have enough people with experience split up to go to 2 smaller sites, and those combined vaccinations, those 2 smaller sites will, be mirroring what we were doing the last couple of days in places like Grimsby and Welland. So, I think it's absolutely, we're splitting up the team, but having had the experience over the last week and a half of getting people really up to speed and optimized, we now have the experience where we can actually split up the team a little bit, spread our leadership a little bit for running those clinics, to be able to run them both at smaller locations.
Thanks, Bonnie. Over to Stephen next. Let me unmute you. There you go.
Hello, everyone. Hope you're all having a great day. Dr. Hirji, when do you feel that, I know we're doing our best to get everyone vaccinated, when do you feel that we'll start to actually see the, I guess, benefits of the vaccination, so that it kind of gives hope to the public that we're kind of getting near the end of this storm? I don't know if you can answer that question or not.
Yeah, I didn't put this data up here, but I think in some limited ways we are already seeing the benefits of vaccination. When we look at infections in the 80+ age group, we can actually see that their infections are falling while it's rising for other age groups. And I think that's a reflection that the 80+ age group is getting vaccinated. As I showed that we're close to, 3/4 of that age group is now vaccinated here in Niagara. Yeah, so we're definitely seeing some benefit from that. I think as we've gone into this second wave and we're seeing cases go up, we've fortunately not seen very large numbers of deaths yet, at least. I think that's again a reflection that the people who are most at risk of dying, which are those individuals who are 80 years of age and older, they're the ones vaccinated. So we're fortunately not seeing many deaths yet from COVID-19. However, the flip side of that is the groups who are not yet vaccinated, which is getting to the people in their 70s and 60s and 50s. Those are the individuals most at risk of being hospitalized, most at risk of needing an ICU admission. And we're definitely seeing those numbers still go up because we have not been able to vaccinate them. And I think it's going to be probably a couple more months before we're able to get those groups vaccinated to the high level, that we'll no longer be seeing our hospitals threatened with really high admissions because of COVID-19 cases. I do think it's probably going to be, a couple months at least before we see that benefit, where we don't need to, be in threat of potential lockdowns to protect our healthcare system. And I think where we are in terms of our cases is probably going to have some impact on that. If our cases are really high, if we're seeing a lot of spread in our community, that means that we probably need to go even longer before those cases come back down. Because one of the biggest risks of seeing infection spreading in our community is if there's a lot of people already infected who can potentially infect you. And so if we are exiting, from to lockdown maybe 2 months from now, exiting from the third wave and cases are still high, that means we probably need to wait a little bit longer before things can really start to normalize. If we're able, though, to control our cases and not see them get much higher over the next couple of months, I think there's an opportunity that, sometime in late May, there could be the opportunity to really start to scale back a lot of the restrictions and no longer live with the threat of a potential lockdown.
And a follow-up, Stephen?
No, that was good. Thank you, Dr. Hirji.
Okay, thank you. Paul Forsyth, you are up next. Let me just get you on the list here. And you should be able to unmute.
Can you hear me?
Yep.
Oh, good. Dr. Hirji, you just mentioned possibly by mid-May, you're hoping that we could see things start to turn around a bit. That's coming up pretty fast. So do you think that, I guess your message is just kind of stay the course until then, right? And are you especially worried because we're heading into a holiday weekend that things could, we could see some bad results in a few weeks?
Yeah, so, I don't think it can be quite stay the course because, of course, this is what staying the course is showing us right now with cases going up. The projections by the federal government, at least, and I'm sure that when the latest provincial modeling comes up, is that, you could see just on this graph, you can see just through the month of April, you get to really astronomical cases. So, I don't think it's so much stay the course, absolutely no longer do what I think we've seen a little bit of across Canada the last couple of weeks has been of greater reopening when things are not going in the right direction. It's absolutely not the time to be taking steps as if we are safer. I think we probably do need to see some more restrictive measures in the short term to really curb this growth long enough that we're able to get vaccinations, at least to those people who are at greatest risk of being hospitalized and really overwhelming our healthcare system. And as you say, May is not too far away. I'm thinking kind of after Victoria Day would be that opportunity. It's not that far away, but we can't lose our nerve now and, throw our hands up in the air and really completely reopen, because this is what the modeling shows is going to happen if we do that. I think we need to not just hold the line for those 2 months, but I think we actually really need to pull back over these 2 months to make sure that we keep things under control. And then once we get past Victoria Day, I think there'll be the opportunity to really recalibrate and lessen a lot of the restrictions in society.
And a follow-up, Paul?
Yes. Of course, Hamilton going into gray zone this week. Could that actually be a bad thing for Niagara? Because couldn't that actually encourage people who might not otherwise to travel from that area to here? I mean, isn't it wiser to have a much broader, uniform set of restrictions in place?
I feel this is a bit of a rock in a hard place. So you put Hamilton in a lockdown, that'll hopefully help reduce their cases, but it's going to perhaps lead to more of their residents traveling to Niagara, traveling to Halton, which are regions in red where there's a little bit more openness, and that perhaps brings infections here. Flip side of that is you leave Hamilton in red. We've of course seen, what that red has done for them over the last few weeks. Their cases are going up really rapidly, so they're going to see more and more cases. There's already a lot of travel between Hamilton and Niagara, so we are already at risk. One of the reasons why our cases have been going up is I think because Hamilton cases spread over to Niagara and lead to our cases going up a little bit. And that's not going to change. And of course, if Hamilton's hospitals start to being overwhelmed, their patients are probably going to be offloaded partly to us, which will start to mean our hospitals get overwhelmed. So I'm not sure I see, a really strong reason we can say that should they go into lockdown, should they not go into lockdown. It's kind of a bad outcome both ways. I think the last part of your answer, though, about a consistent approach, I think is really important, because I think the way we actually address this is really we need to treat the entire Golden Horseshoe as one unit, given all the travel, given all the integration between us. And we really all need to go in lockstep to having the same restrictions and a higher level of restrictions. And a big part of that is that we've seen that the gray lockdown doesn't really keep cases under control. Hamilton went into that gray lockdown back in December. It didn't slow their growth of cases. Toronto, Peel were in a gray lockdown in November. It wasn't stopping their cases going up. They were in a gray lockdown right now. It's not stopping their cases going up right now. I really think that the only way you actually get all cases under control across the Golden Horseshoe is probably when all of us go into lockdown together, as happened during the first and second waves. And those are the only times that we saw places like Hamilton, Peel, Toronto, all see their cases come down. So I do think there is a room for consistency, that we need to be treating the Golden Horseshoe as one big unit. And unfortunately, with cases rising in every part of the Golden Horseshoe right now, we all need to probably go into a higher level of restrictions to bring cases under control and get out, through these next couple months before vaccination is going to protect us.
Thank you, Paul. Up next, we have Ludwig. Unmute you. You should be good.
Good. Can you hear me?
Yeah.
Thank you. Great. Hello, Dr. Hergy. Hello, everyone. Dr. Hergy, in regards to the outbreak at Brock University student residences that you talked about before the weekend, or at least issued a statement on, could you update us on what's going on there? I know it was 12 cases, I believe, before the weekend. So if you could give us some insight into that and how your contact tracing is going. I know Brock mentioned social activities, so I'm assuming that you're looking at something special there.
Yeah, I wouldn't say something special. We find social activities are really part of all cases where we do contact tracing on. It's probably, one of the big risk factors for getting COVID-19 is that you've had social interaction with others. But, there do seem to have been some relatively larger ones here. So we have, of course, done our usual, where all people who've been infected with COVID-19 have been isolated. We're testing lots of people to make sure we've identified all the people who are infected, and anybody who newly developed symptoms is going to be tested as well to make sure we don't miss any cases. We're following up to find out who are all the contacts of these individuals. Those could be contacts that they live in the same household with in student housing, could be contacts they're at social activities with, contacts of other sorts of social interactions that they had. And we're actually largely isolating those persons as well, because they're all at risk of developing infection as well. It's quite a large number of people. I think, we're, high double digits, if not into the triple digits of number of persons who've needed to be isolated as part of this outbreak, and we're continuing to monitor them going forward. Of course, it's difficult for anybody to remain isolated. So we're working with Brock University to figure out some of the different ways we can support these individuals to make sure that they remain isolated and don't feel too much incentive to break isolation or leave the places where they're isolating. And we're going to continue to watch and hopefully not see too many more cases from this outbreak. Some of the contacts are isolated. We do expect will eventually develop symptoms of infection and do become cases, but we hope that we've captured everybody. And so nobody who's not isolated will become a new case.
And a follow-up question, Ludwig?
Yes, thank you for that. So, just generally about the caseload, I know that it's usually pretty hard for you to pinpoint exactly if there was any common pattern, but I noticed this weekend we had a total of 132 new cases, and 81 on Saturday, and so those are pretty high daily increases. So I'm just wondering, and also in regards to Thorold, we have now, I think, 51 cases. And Welland seems to have like 91 active cases. So like, what's happening there with the daily case counts? And if you could mention Thorold in there, I'd be grateful. Thanks.
Great. Yeah. There's not a whole lot of a pattern that I can talk about here. Very few of the cases are linked to Brock University. That's not really the driver of why these cases are going up. The best explanation is that we are really seeing the pattern of the community as a whole, of Niagara, Ontario, seeing cases go up, and that's really a reflection of what I think we saw this weekend with the 132 additional cases. With respect to Thorold, I unfortunately don't have additional information I can share with you right now. I need to take another look to see if there's any particular pattern there, particularly if there's perhaps some students who are living off campus in the Thorold area who might be some of those cases. I'll need to get back to you on that.
Okay, thank you, Ludwig. Up next, we have Gord. Let me unmute you here. There you go.
Hi, thanks. Dr. Hergy, just wondering whether, was the Brock event tied to St. Patrick's Day, and was St. Patrick's Day a particular problem this year?
So there wasn't one event at Brock. This was a group of people who had many different social activities. And, some people are at one, some people are at another, some people might have been in multiple of them. And so it's not all linked to just one event. There were some social activities around St. Patrick's Day that we're investigating as being part of this, but also many other activities. And we can't pinpoint exactly which ones necessarily led to the infection spreading at this point, but really any social activity is a risk of infection spreading. And so it's unfortunate that we did see that.
And a follow-up, Gord?
Also, I wondered too, last week when we were talking, you said, we asked about moving to the 70 to 74 age group, and you thought you would need at that point all the clinic dates and projected vaccines just to finish the 75 and up crowd, where there's about 50,000 or so, I thought you said. Did you, when the province announced Sunday that Niagara would take the 70 to 74, is there enough booking spaces for those people at the moment, and vaccine at this point?
Yeah, so our bookings for clinics that are made available really match the vaccine that we have. So vaccine is never going to be running out for our clinics because we plan very carefully for that. One big change that's happened is that Niagara Health has actually opened up a larger proportion of their clinic spots to this elderly population through the provincial portal. And so between that and the clinic spots that we have available, we definitely have enough for the 75 to 79 age group. I'm not sure if we have enough entirely for the 70 to 74 age group. We haven't looked at the exact numbers yet for that. We are, though, starting to get more information on what vaccine shipments are going to look like through the middle part of April. So we are going to have some more clinic dates opening up over the next few days. So I think with those additional dates opening up, we should be good to be able to get everybody from 70 years onwards up into a clinic date. It just could mean that registering this week, they might be registering 2 to 3 weeks down the line before they actually have the opening for getting into a clinic.
Okay, thank you, Gord. Next, we have Penny Coles. Get you on the list here. You should be able to unmute now.
So to continue on with the vaccinations, I hate to belabor this. You said you think that the 70 to 70 and up that opened this morning, that you thought was going very well with a very few exceptions. Maybe it's just because I'm hearing from Niagara Lake people, but what I'm hearing is very different, that by 9 o'clock this morning, there were no openings. One person reported being able to phone and get a booking. Other people I've spoke to have said even by phone, they were told between 9 and 10 o'clock this morning that there were no appointments available in Niagara. I don't understand whether you're able to see, because we know we've had glitches in Niagara Lake in the past. Are you able to actually see whether there are appointments available in Niagara? I get that it's not your system, but can you tell if this is just a glitch or if the appointments are in fact booked?
We can actually see if there are appointments available or booked. And one thing that we have seen from time to time is that there are appointments that seem to be available and concerns that people are going on the system and not seeing those appointments. And that's what I meant by there seem to be some glitches in the system where some appointments aren't available for others. We've definitely heard that there's a fair number of complaints of people who are having struggle getting booked. The flip side of that is that we saw a few thousand new bookings successfully go through this morning. And so, of course, people who've successfully managed to book are generally not the ones we're going to hear from. It's going to be the people who are struggling. So I do think it's a majority of people have had success, but absolutely, there is a relatively larger minority of people who are struggling this morning with getting into a booking. Part of that is some of these technical glitches, but I think it's actually, we are starting to hit up to the point where we're seeing our clinics get full. We started the day with, probably a couple hundred appointments remaining in Niagara-on-the-Lake, and those are pretty much all booked up now. And so obviously, if people were really hoping to register into the Niagara-on-the-Lake clinic, that's unfortunately now one that's filled up. There are still some appointments elsewhere in Niagara. St. Catharines, for example, does still have some appointments. I think there's a few for the April 10th date in Fort Erie. So there are still some appointments available in Niagara, but they're absolutely not in every location. I think that could also be part of the frustration that people are feeling, that if they are successful getting on the booking system, they're not seeing at the location that they want to get to. As I mentioned, we'll have some new clinic appointments hopefully up within the next couple of days for the middle part of April. That'll hopefully give people more choices of where they want to go to get vaccinated.
And a follow-up, Penny?
Yes, can you be a little more specific than the next few days for the people who this morning have tried to go online? And the ones that I've heard about are not just, it's not just for Niagara-on-the-Lake bookings, it's for Niagara region where they haven't been able to get an appointment. So I'm not sure what that's all about, but the sooner we could be apprised of when there will be new clinics online, and so when we should start to look for those, the more helpful that would be. So when you say a couple of days, can you narrow that down at all?
Yeah, unfortunately I can't. We actually submitted a list end of last week to the province to get onto the system. And so it's really in the province's court is when it's going to start to show up there. Our hope is that it's going to really be the next day or two, but we don't know exactly when that's going to be because it's a bit out of our control. So, if I wish I could give you more specifics and give everybody more specifics so they knew exactly when they should try next, but unfortunately I don't have that information.
I know I've already asked my follow-up question, but could I just ask, when you say it's out of your control, is it because you don't know whether you'll have the vaccine?
It's absolutely not an issue with vaccine. We've got projections for vaccines through the middle of April, which is why we decided on how many clinic appointments we'd have and where. It's out of our control because it's a provincial booking system. We've submitted to the province the days and numbers of appointments that we want to have on each of those days. And it's just about them actually getting it uploaded in the system in live.
Okay, thanks, Penny. One thing I'll note is that once we know that those additional clinics are going to be live and up on the system, we'll send out a media release from Niagara Region. So if you subscribe to our media releases and follow us on Twitter, we'll be sure to share it on there as well when those clinics are added to the site. Okay, last person for this round is Dawn Mitchell. You should be able to unmute now. Don, are you seeing that you can unmute?
Sorry about that. I missed that one. Thanks, Dr. Hirji. Thanks for taking my call. There's an issue going on in Toronto right now, unfulfilled appointments. They're worried about vaccine waste, that sort of thing. That's not going to be an issue in Niagara, and if so, why not?
I can't predict what the future is going to hold, but thus far it has not been an issue. We do have a small number of no-shows for appointments every day, on the order of maybe 10 people at most. So it's not been a very large number. We do have a list that we maintain of people who are on the prioritized group for getting vaccinations. And as we're getting near the end of the day, if it looks like we have a few extra doses that are going to be available, we start to call people in to make sure every dose gets into arms. We have not had any doses go to waste because we haven't had someone we could vaccinate with it.
And a follow-up, Don?
Yeah, and my follow-up would just be for the 3 outbreaks at the health facilities that are going on right now. And you'd mentioned last week that a lot of these outbreaks they're kind of small now because vaccination is happening. Is that the case with these ones?
Yeah, that's absolutely the case with these ones. I think they may all be actually just one case, if not there's at most 2 or 3 cases. It's really, night and day of what we see with outbreaks now compared to where we were a couple of months ago, where a couple months ago, an infection would happen in one of these long-term care homes or retirement homes, and they would just spread to everybody else. And now, fortunately, one of those infections appears and it really just seems to fizzle there. And that's, I think, a really strong indication of how great the vaccine is. It's really protecting a lot of lives as a result of us being able to get those residents vaccinated. And I hope this is a message that really everybody else in society takes, that these vaccines we have are really working, and we should all be taking them so that we can make sure we get out of this pandemic.
Okay, great. Thank you, everyone. So if you would like to ask a follow-up question, please let me know in the chat. I see that Gord and Bonnie have already sent a message. So Gord, go ahead for one more question. Just let me find you on the list. Okay, you should be able to unmute now.
Okay. You've detected 274 variants cases so far. Do you know how many of those are active right now?
I don't know the active number, unfortunately. It'd be a 2-digit number, I'm sure. I can't really tell you off the top of my head how many of those are active.
Okay, Bonnie, you can go ahead.
Dr. Hirji, just kind of following up on the issues with the vaccination appointments with Ontario's booking system. Have you had conversations locally on taking ownership of the booking system and making it a regional system instead of using Ontario's?
We haven't had those discussions here. We've seen a lot of parts of the North America have struggled with their registration systems, with systems crashing and the like. We worry that if we start to build our own system, we would probably end up with some issues again. There would be glitches, there would be problems, and we wouldn't have the same resources as the provincial government to go around fixing them. I don't think it would necessarily lead to a better outcome for our residents. It would just change the source of where those issues are. And I think it's best for us to stick with the provincial system, which fortunately I think is working for 95% of people. It's just a small minority who are running into struggles, and hopefully over time, as we get these issues ironed out, it's going to become much more reliable for everyone.
Okay, Ludwig, another question for you.
Hello, thank you. I was disconnected there during your last answer, Dr. Hirji. So I was just wondering if you would mind recapping just for me. 51 active cases now in Thorold and 90 in Welland. So I was just wondering if you could tell me if you've got any idea on what's going on here.
Yeah, unfortunately, I don't have any information I can share specifically with Thorold and Welland. That's something you can touch base with you afterwards around some information.
Okay, and Penny, one more question.
Yes, going back to vaccinations again, what about pharmacies? We haven't talked about those today. I understand across the province, the areas where pharmacies were allowed to take bookings for 60 and over, they filled up very quickly and are taking waiting lists and waiting to hear when they will get more vaccine. And I think there's a bit of concern in Niagara from people who have been trying to do that those areas will get their vaccine and our pharmacies won't. Do you have any information about pharmacies in Niagara?
I don't have any specifics yet. The province has definitely signaled that they're going to be expanding to more pharmacies and more primary care providers very soon. We know the province acquired 1.5 million doses of AstraZeneca from the US government, where they're basically borrowing that and will give it back to the US at a later date once AstraZeneca gets approved in the US. And so I assume that 1.5 million, the Ontario portion of that is going to go to primary care and pharmacies. And so we'll see more primary care offices and pharmacies get vaccine, but how many will be in Niagara, which ones in Niagara, I haven't heard anything yet, or even what the timeline of that will be, though I'm hoping it's going to be in the next couple of weeks, given that I presume that 1.5 million doses is coming to Canada pretty soon.
Okay, thank you everyone for joining us this week. And a reminder, next week, our session will be on Tuesday at 12:45 because of the holiday on Easter Monday. So thanks again, and we will see you next week.